So you're dealing with TMJ symptoms, painful jaw problems, and you're not really sure what to do about it or what treatment to seek. And I think rightfully so. These symptoms can be irritating, they're definitely frustrating, and one of the hardest symptoms to deal with as a person, because it's like when this area of your face hurts, it's like you as a person hurts. Most people don't know what to do about it, who they should ask questions to, or how to get their life back and finally stop defining themselves by jaw pain or by a TMJ. You're not a TMJ, you're not a pain, you're just a person looking for some answers. If you don't know me, my name is Dr. Chad Shafer. I'm a physical therapist and TMJ expert here in Troy. And I'm just here to give you the best information about yourself, your TMJ symptoms, and how it affects and impacts your overall quality of life. I had a patient the other day that just really inspired me. She showed me that she can definitely get better. And just by the first interaction we had with each other, I knew that she was going to be able to stop defining herself by her diagnosis, and that she was going to move past this and move to the next level. This was a person that lived with symptoms for years. She had the whole gamut of treatment. She's been to another practitioner, she saw somebody for years, she even saw a specialist for a couple of months and find absolutely no relief. And she opened up to this about me because she was frustrated and irritated and was just looking for some real good quality answers on what she was dealing with. She had problems with chewing. Her stress levels were elevated. She was having problems at work because of her jaw pain and her TMJ, and she wasn't really sure what to do. Well, we looked at her a couple weeks after her first session, and it was fantastic. The way that she transformed herself and her quality of life and just took her back to where she wanted to be in relation to her health, her goals, and ultimately she learned and she told me that she just stopped defining herself by her TMJ diagnosis. What else did you try that didn't work?
At first I tried resting it, ice, heat. I tried that for about 6 weeks. I had no success.
Now that you've had the PT experience, if you had a friend who was experiencing the same thing, would you recommend to come and see us, and why?
I would definitely recommend to come and see you. It was a very personable experience, so it was just me and the therapist, and I didn't have to worry about anybody else in the room, anybody else listening as to what was going on, or their idea of what my problem would be.
And she was able to decrease the reliance on pills and medications because she knew that that was not the answer, but she wasn't really sure what to do about it, where to turn, or really what actions to take. Now, if this sounds like you, I want to talk to you because this is not the first time that I've heard this story. And the reason that I work with people that are dealing with TMJ and jaw pain because I think it is really important. And I think it's important that we get the word out to as many people as possible that you are not defined by this. You definitely don't have to wait till this gets worse. And there are real techniques that you can do on your own that you can self-treat yourself, improve your symptoms, and put this behind you so you don't have to worry about this getting worse or to the point where you have to take off time from work or to the point where your relationship's affected because your stress levels are so high or your pain is so intolerable. Now again, if this sounds like you, I want to talk to you because I want to give you the best information about yourself and your health care. I even had another patient that had a little bit different story, but it was still really inspiring. They were talking about a TMJ night guard and an orthotic they had in the past. They told me that they went through the whole rigmarole of getting treated and fitted for this specialized orthotic and this night guard and found that it only gave her temporary relief. And she was looking for other answers, but she was super skeptical on who to talk to and who to request treatment from because she's had experiences in the past that just honestly weren't so good. And what we found out that her symptoms were actually coming partially from her neck. And we realized that she was actually having headaches and some neck pain. So indirectly, her symptoms got a little bit better in her neck and her TMJ symptoms were eventually able to be resolved. And the most important thing was she could treat this on herself and she could get rid of her own symptoms by herself, which is absolutely huge. Think about that if that happened to you. What would your life look like if your quality of life has improved, your pain has decreased, and you could finally manage this to a point where your life looks just a little bit different? maybe even if it's 10, 20, 30%, how would your life look if your symptoms got just a little bit better? Now, I want to give you the best information about how to do this, how to improve your symptoms, ditch TMJ symptoms, and just get back to the life that you want and you know you deserve. And I have a couple of options of doing this. The first one is just a couple of free resources. Now, I have tons of these. It could be in the form of sending me a direct message on the bottom of this page. You can check out my blueprint to TMJ and facial pain relief. Ask any and all questions that you'd like via email, or check out the book. It's jam-packed full of awesome information. And you're going to get some really helpful emails about what you're dealing with, why you don't have to be defined by your TMJ symptoms, and how to finally move past that so you can get back to the life that you want and you know you deserve. So that's the free ebook. That's the number one choice. So that is for somebody that is kind of skeptical, they're not really sure, they don't want to email anybody, and they're not really sure where to go or who to talk to. Check out the free ebook. It's there for you to read, to consume, and hopefully to better your life. The second option is called the discovery visit. Now, unlike other healthcare practitioners that maybe give you 6-8 minutes of your time and spend most of their time on the computer jotting away, not even giving you the time of day or eye contact, I want to give you something a little bit different. And actually, it's a lot of bit different. The discovery visit is simply a conversation. No pressure, no sales, marketing tactics. It's just a conversation between myself and you. I want to figure out what's important to you, why you may be having your TMJ symptoms, and why they haven't been resolved with prior treatment in the past. Because that is one of the biggest things that people are skeptical about is, I've had prior treatment, why would I go have this treated again? What would be different? Let's have that conversation. Let's figure out why that is unique to you, your symptoms, and your overall life. Now, the next option is an evaluation. Now, this is absolutely unheard of in healthcare today. This is a full 60 minutes with a TMJ expert in this field. I literally work with patients every single day that are dealing with TMJ symptoms and jaw pain. And I want to give you that information. And I want to give you the information on how to take your health back, how to improve your quality of life, how to decrease your symptoms to a point where you can self-treat this on your own. You don't have to rely on pills, medications, in some cases orthotics or night guards. I just want to give you the best information about how to treat this and how to get back to the life that you know you deserve, help you reach your goals, and finally figure out the root cause of what you're dealing with. Now, that's an evaluation. That's for somebody that's ready to go. Maybe you've done all your research. Maybe you've looked here on Google or YouTube. You've looked at other websites. An evaluation is going to be good for you. So again, to sum that up, the ebook is going to be great information about what you're dealing with. Maybe just give you a little bit more information and thoughts from an expert in this field. Discovery Visit is completely free, absolutely unheard of in healthcare. It's a 15 to 20 minute conversation either in the clinic here in Troy or on the phone. I want to help you figure out what you're dealing with. And lastly, the evaluation is going to be for somebody that's ready to go. They understand what's important to their health and what they're dealing with, and they want to figure this out today. So again, if this sounds like you, I want to talk to you, and I want to give you the best information about yourself and your own healthcare.